I am very pleased to have with us as our guest Richard Burke, President and CEO of Fallon Health. Richard, welcome.
Thank you, Tim.
Well, Richard, you've been on the show different times over the years, but this year is especially significant for Fallon Health in that celebrating anniversary.
That's right. Thank you, Tim, for having me. We're celebrating our 40th anniversary. Fallon was founded in 1977 by then, at the time, Fallon Clinic, and it was an innovative idea at the time, and has had a really great and interesting and distinguished history. So we're marking it this year and looking forward to many years to come.
You know, and I think it's important to kind of reflect just a little bit in 40 years how much the economy's changed. You know, manufacturing's still extremely important to the Central Mass economy, but probably in the 70s still one of the dominant industries, or the dominant, still in the top 4. But healthcare has become the dominant employer in Central Massachusetts, and Fallon is a big part of that.
It is, and as the economy has changed, Fallon has had to change. So as businesses change and the needs of businesses change, their needs for healthcare coverage, both affordable, high-quality coverage and coverage across a broad geography changes. And so we've had to change with the economy over that period of time. Well,
that's the hallmark of innovation, and that's, you know, you mentioned an innovative company. And maybe just, you know, in just a few minutes' time, we could kind of talk through that history of how the company has evolved and adapt and continued to provide important care delivery.
Sure. So again, we were founded in 1977 by then Fallon Clinic, and they had an idea which was very, very advanced for its time, and that is to bring the different parts of the healthcare system together: the insurer, the hospital, the providers of care, on behalf of the community we serve, and they did that very, very well. And in some ways, it's what's continuing, what people are trying to do today.
Back to the future.
It is very much back to the future. I think what you hear in national debates today about quality of care at an affordable cost and getting everyone working together in a coordinated fashion is what Fallon started out being all about, and continues to do to this day.
And like any innovative organization, you've got to adapt, and there have been companies and affiliates working, and you expanded some of the ways you care and target certain sectors.
That's right. We have adapted over the years. So we started out pretty much built around one provider group, and then over the years we've expanded geographically across the state. We've actually expanded beyond the state. We have an operation in Western New York, which we're very excited about. And so we've brought other providers of care into our network, and we've also changed the products we offered. So as the demographics shift and as the needs of the society shift, we've shifted the products we've offered. So for example, you will see, we've seen growth over the last many years in our senior products as the demographics change, the aging of the population. We also see, with the passage of the Chapter 58, the Massachusetts healthcare reform, and then subsequently the Affordable Care Act in 2010, the expansion of coverage, both Medicaid expansion as well as expansion of coverage through subsidies. And so we've adjusted our product portfolio in response to that, and we've seen growth in that, which has been really good.
You know, I mentioned how that the healthcare industry has become the dominant employer in the region, and you know, it provides entry points for people, if they're people motivated to work, regardless of kind of the educational attainment levels. There's different ways you can plug into the healthcare system, and employment is an opportunity. The best social welfare program is a job.
That's right.
But I think from an economic development point of view and impact on the community, I mean, Fallon's corporate headquarters is here in Worcester, Central Mass, and that continues.
Yeah, we're proud to call Worcester our home, founded here, as I said, headquartered here, and growing here. So we have about approximately 1,200 employees spread out across our various sites across the state, and as I said, in Western New York, but the predominant employment is here, right in Worcester and right in downtown Worcester, and we've watched and feel like we're a part of the renaissance in downtown Worcester, and really excited about what's happening in downtown, and proud to call downtown our home and Worcester our home, and we will continue to add jobs over over the years.
Well, you think about you know, the things that have made downtown successful or in the past contributed to their struggles. It's having a presence,
Yep.
18-hour a day, people working and living downtown, and Fallon has always had that significant presence, has been a constant, and been actually a generator of one of the relatively newer buildings in the downtown over the last 20, 30 years over Chestnut Place.
That's right. Yeah, Chestnut Place is great, and we call that our home.
Right, and the impact of that beyond jobs, but also, I mean, you and your entire team and the employee base are involved in the community in a variety of different kind of ways that give back and contribute to
That's right. I think it's very important, and that's part of the culture at Fallon. You know, we are there to serve our members, but we also know that any successful company has to be surrounded by a successful community. And so it's a big part of what we are dedicated to is community service. And so we encourage our employees. We give an opportunity for all our employees to volunteer time in the community, and certainly encourage our senior team to be involved in boards and other ways, and support good causes and those sorts of initiatives that are going to help Worcester advance. I think what's one of the great things about Worcester is it is a very community-focused business community. You know, the business community cares about the city, and so we feel we should be part of that.
Well, we appreciate it on lots of different levels, including at the Chamber. Richard, you can't turn on the TV or the radio or go on your handheld device or the, you know, healthcare, read the newspaper. Healthcare is continuing to be a dominant piece of what's driving the debate in Washington and Boston, lots of different places. What's going on? That's a tough question, and does anyone know?
I don't know if anyone really knows what's going on. I think what folks are discovering is that it's a complicated topic. It's complicated because it touches everyone's life, and the expansion of coverage in Massachusetts and then nationwide has been, in my view, a very, very positive thing. But it's expensive, it's complicated, it has unintended consequences. And my hope is, I can't tell you what's going to happen, I don't know, but I would think that in the end of the day, there will be some tweaks to the, I guess I'll tell you, I hope that there are tweaks to the Affordable Care Act, but I don't think a wholesale change would be an advisable thing, nor do I think it will happen. I think even just seeing what happened most recently with the efforts to repeal and replace turned out to be pretty tough to do, because I think the unintended consequences are real, and so I think Congress will probably tread slowly and lightly until there's a clearer path forward.
You know, and if past is prologue in Massachusetts, with Fallon a big part of that being an innovator for the country. I mean, in 2006, Governor Romney and the legislature signed Romney Care, Chapter 58.
That's right.
With Governor Patrick, we were part of that team that implemented and led it, but we needed to make tweaks subsequently to that through some legislation.
Question.
So you learn as you go along and you try to fix things. And what you're saying is they need to do that in Washington.
I think so. I think Washington and the rest of the country can learn from Massachusetts. That Massachusetts tackled, the first thing Massachusetts tackled was coverage. And I think that's what the Affordable Care Act does, coverage, broader number of people with insurance. But then the next step is tackling cost, because healthcare is expensive and there are not unlimited resources. And I think that's what Massachusetts has been working on with subsequent legislation to Chapter 58, many of which came under Governor Patrick. And I think that's probably what will have to happen at the national level, is begin to implement programs that will address the cost of care. And certainly one of the key ways to address the cost of care, back to the past is prologue, is the idea of coordinated care and bringing the different parts of the healthcare system together. And that's where I'm very excited about Fallon, because it's always been part of what we do, is we focus on how do you work most effectively with the providers of care as the insurer on behalf of the beneficiary.
Yeah, and you know, when you come back to, you know, it's immensely complicated, lots of different levels, but you know, the one kind of concept that keeps, you know, me focused on around this in different levels is when you think about your own care, that of your family, you know, the relationship with the docs and kind of your insurance company. But, you know, we know from the data, it's, you know, if you've got healthcare coverage, you've got a relationship with a doctor, insurance, a navigator, and then you can focus on prevention, wellness, and we know that this, forget what the percentage is, but 20%, let's say, seem to drive 80% of the costs. I've heard something along that.
That's absolutely true. No, 20% of 20% of the people who are covered drive 80% of the cost. And the best way to control healthcare costs in the long run, and really to achieve what you really want, which is the highest quality of care, is to focus on prevention and focus on that relationship and access to your healthcare provider. So it's
coordination of care.
It's so critical.
What's next? Not on national health care, but and I know a lot of what happens nationally is going to depend on what you see kind of for Fallon and the years ahead.
What's next for Fallon? Well, I think we will continue to focus on, you know, for me, the three things we focus on are our members, our employees, and the community. And those are the things that, you know, that we focus on every day. What's right for our members, what's good for our community, what's good for our employees. And what's next for us is that we will continue to change and innovate with the times. I think, as I said, as the demographics continue to change, we will respond with innovative products. I think as coverage, as the state, I think the state has a very strong commitment to coverage, and we will be part of that.
Great. Well, Richard, happy anniversary to Fallon Health. It's great having you on the show, and we welcome and enjoyed having members of your team to talk about some of the different programs, and looking forward to having you back here for the 50th.
All right, thank you.